Expectant families facing complex pregnancies now have new hope closer to home.
MU Healthcare has launched a groundbreaking fetal intervention center, the first of its kind in central Missouri, bringing advanced life-saving care to both mothers and babies before birth. In this Focus on Your Health, Meg Judy speaks with two of the leading doctors behind the program to learn how it's changing lives.
Focus on Your Health is sponsored by MU Healthcare.
Welcome. I'm joined by MU Healthcare's Dr. David Streitman. He's a maternal fetal medicine specialist, and then Dr. Ronnie Marwan, a pediatric and fetal surgeon. Thanks for being with us today.
Thanks for having us.
Dr. Streitman, tell me about MU Healthcare's Fetal Intervention Center and why it's so important for the families that are here in Missouri.
For the first time in central Missouri, we've brought together all the team members that are necessary to take care of not only the mom, but the baby before birth and during birth.
And Dr. Marwan, you're helping these babies before they're even born, right?
Right, yeah, when they're still in the womb, and we identify whether they have a problem that needs to be addressed right there and then. And sometimes we offer an intervention, but sometimes it's just understanding what that means for the mom and the baby when the baby is born.
Okay, and what would be some of the conditions that are diagnosed?
The one that your viewers may be most familiar with would be twin-twin transfusion syndrome that we see in some cases of identical twins where the babies don't share blood equally through the placenta. It is amenable to treatment during the pregnancy if it becomes progressively complicated.
And you do that in the womb?
Yes, we do. We're able to take the mother to the operating room and use minimally invasive techniques once we've identified the disease and assessed how far along the disease process is. And we can use a laser to actually separate the circulations of the babies while they remain in the womb for the rest of the pregnancy.
Unbelievable. And Dr. Marwan, tell me about an exit procedure.
Yeah, an exit procedure is a procedure designed to treat a baby while the baby is on maternal support. So think about the mom as the bypass machine, and that allows us to take care of a critical condition in the baby before they're born.
So this is mid-delivery.
Yes.
Sounds like a team effort. You have a lot of specialties that get involved, I would imagine.
We do, both on the pediatric side and on the mother's side. We bring to the table pediatric specialists as needed, and then if mother develops any sort of complications, we have the various adult specialties here as well.
Right, and Dr. Marwan, tell me about the Level 3 NICU team.
Yeah, so a Level 3 NICU means that we have all the team members, specialists on the pediatric side of things and on the surgical side of things, so that we can take care of these babies when they're born. And that, by definition, is a Level 3 NICU.
Lots of moving parts in this particular realm of MU Healthcare, huh?
It takes quite a bit of effort to put together the whole team and to train everybody up and acquire all the equipment and expertise in one location. So yes, several moving parts.
And then there's an important relationship between MU Healthcare and the Ronald McDonald House.
Yeah, right. You know, when you have a Ronald McDonald House in your backyard, it allows the families to kind of be around other parents, to have a little bit of a reprieve, separation from the stress and the anxiety of being in the hospital all the time. And we're fortunate to have that over here as well.
Wonderful. Thank you, Dr. Streitman, Dr. Marwan. I appreciate you sharing your wealth of knowledge and for sharing how MU Healthcare's new Fetal Intervention Center is making a difference for families all across Missouri. Visit muhealth.org/fetalcarefocus. For Focus on Your Health, I'm Meg Judy.
Focus on Your Health has been sponsored by MU Healthcare.